Is there facial masculinization surgery? Of course, there are procedures where an individual wants their face to look more masculine, and we try to contour our procedures to masculinize that individual's face. It is much less commonly asked for than is facial feminization. The number of people who want their face masculinized is less than the number that want it feminized. One of the things is the male human head is bigger than the female human head. And the structures, the jawline, the nose, the forehead, the bones are bigger. And the soft tissue is generally thicker and the muscles are a little bigger. So some of those things we can do and achieve via surgery. The easiest and the most common is to operate on someone's nose. What are typical facial masculinization procedures? Rather than a reduction rhinoplasty, which is commonly done, we're usually augmenting the nose and making it a little bit larger, giving it a stronger bridge, giving it a stronger tip, those kind of things. And that often requires cartilage, and the cartilage is often taken from the ear or rib if there's not enough nasal septal cartilage. So we've got to make it bigger. Augmenting the chin can be done with bony surgery or with an implant. Augmenting the lateral jaw can be done to give strength and lateral projection of the jaw. And augmenting the cheeks can also be done. The last, and what is a little harder to do, is to augment the frontal bone. We reduce the frontal bone a lot of times in feminization surgery. Can you get an Adam's apple implant? A question I get asked is, can you do something to the Adam's apple? Is there an Adam's apple implant? An Adam's apple graft has been described. I don't really love this procedure, and I'll explain why, but it can be done. As a general rule, if you look at the male Adam's apple, the thyroid cartilage, it's more prominent and it's narrower than the female's, which is softer and sits back a little bit more. So if you look at my Adam's apple, you can almost see when I swallow and I talk, my sharp Adam's apple, because I've got a thin neck, you can see it moving. So we can recreate that with a cartilage graft. It's not really an implant is foreign. It's a lot of surgery to create a little change, but we could take the female thyroid cartilage and graft on top of that with a created rib cartilage. We fashion a graft, we put it in, we sew it into place. How much does facial masculinization surgery cost? Well, it depends on what's getting done, like any surgery or combination of surgeries. If we're doing a lot of things, jaw augmentation, lateral jaw augmentation, nasal surgery, it may cost a lot and maybe $25,000 or $30,000. If we're doing one smaller procedure, it costs much less. So it depends a little on what's getting done. And that requires an individualized consultation, or a few of them, in which case I've got to listen to you and hear what you want. And then I've got to concoct a surgery that will work for your face, that makes it the most balanced and how you want it to be. If you have questions about this, call or email me anytime. I love doing this kind of surgery. I love taking care of my patients and listening to their issues or their problems. I'd love to hear from you, and I look forward to seeing you in my office. Thanks so much for watching today.